Hi, my name's Destiny, and I'm going to be your happy nursing student. I'm just going to close the door to give us some privacy. Okay, can I have a name and date of birth? Okay. Hello, Mr. Smith. So today we have a physician's order to change your abdominal wound dressing. I did come here earlier, about 30 minutes, just to see if you want any pain medication, and you did decline. So we're just going to start by removing the dressing, and then I will apply some new ones. Before I even start, do you have any allergies? No allergies? Okay, good. So I'm just going to don some gloves on. And I do see that you are safe in your bed, and I am going to, and I did lower the bed railing, and I'm just going to put them up later. Okay, so let's start by taking off your old dressing. So I'm just going to start by pulling the tape in, just so it doesn't get stuck onto your skin. Okay. So just assessing the drainage using Coca. For color, I see a clear color, no odor, consistency is liquid, and the amount is scanty. So now I'm just going to throw my the old dressings off, and I'm going to be removing my gloves. Now I'm going to be assessing the incisions using Reedema. There's a little redness. I don't see any edema, no ecchymosis. The amount, the drainage I already assessed earlier. The approximations appears to be fair. The edges around are equal. And I am going to measure without touching my patient. Appears to be 6 inches. Okay, and I see you have 1, 2, 3, 4, about 5 stitches, and they do appear to be intact. So now I'm just going to start setting up our equipment for your sterile dressing. Okay, first I'm going to rip a tape, so I have some tape ready for when I open my alcohol swab. Just going to put that on the side. Now I'm going to open my alcohol swab. I would rip from the side, and tear up. Throw that out. Now with the tape, and then I would push the swabs up because they're just at the bottom, just to make it a little easier. Fold that up, putting my tape on, and I will not be crossing over these swabs while doing this. And I would be placing the tape here, making sure I never cross over the swabs. Okay, now I'm going to start by putting my gauzes. First, going to be opening my 4x4. I'm just putting that on the edge. Then my abdominal gauze. Okay, and without crossing over my 4x4 gauze, I'm just going to push the gauze over, and my fingers are only touching the outer edge, never touching in or the gauze itself, just the white. Okay, now I'm just going to be grabbing my gloves, opening that. I'm going to discard of that. Just opening, and I just want to make sure when I open my gloves that it's not touching my my alcohol swabs nor my other gauzes. So just making sure they don't touch. Doing the side that's farthest away from me, inner, and just touching this. Okay, paper's not touching. Now picking up one glove first, I'm just going to be touching the cuff and inserting my hand. I'm just going to bring that down, still touching the outside in the cuff. Okay, now I'm going to pick this up, discarded my paper. Okay, and I'm having the sterile side, my hands are touching the sterile side. Now I'm just going to be inserting my hand believe my gloves are, yep, okay. Just making sure I can put those in. There we go. And now I can readjust my gloves because this side is dural. So I'm just going to readjust it because dural can touch dural. Okay. Now I have that. I'm first going to start with cleaning the wound, and I'm going to be using my alcohol swabs. So just touching it, grabbing it from the side, just so I don't reach over it. I'm going to do proximal from Dixil, or head to toe. And I'm going to start in the middle. And without touching my patient, I'm working my way down. And with I'm going to discard this, and my hand's not going to go below my waist. Then grabbing another one. Okay. Going the farthest. Drop it. Can you see? Okay. And last one. Okay. Discard. Now I'm going to be grabbing my 4x4s. Okay. And once I place them on top of the patient, I can no longer move them. Okay. Now grabbing my gauze. Just touching the sides only. I do have my blue lines on top. And I'm going to put that on. Okay, at this point I am allowed to take my gloves off. I will not be breaking any rules of sterility. So I'm just going to remove my gloves. Discard. Discard. Okay, now I'm just going to be taping. I'm going to do the side that's closest to me. Okay, in my last tape, I'm just going to be writing my initials, date of birth, and the time. Okay, Mr. Smith, we finished up. So I'm just going to put your bed railings up. And do you need anything? Okay, nope, have a good day.